Are you having a hard time getting pregnant? What are 5 common causes of fertility struggles and what you should do about them? Hi, friends. I'm Dr. Natalie Crawford. I'm a board certified OBGYN and REI. So I'm a fertility doctor. And every single day, I talk to people about how they can change their life or get more understanding, or if they're doing fertility treatments, how they can have the highest level of success possible. And online, that is what I'm doing with this channel and with my other information just to help educate you. So we're going to dive into top 5 causes of fertility struggles so that you can be more informed. So please subscribe, share, like, leave a comment so we can keep making content that you want, and so that our message about fertility awareness and understanding your body so that you can advocate for yourself and understand what to do spreads to more people. Also, real quick plug, the fertility formula is coming in 2026. Everything we cover today is there in much more detail. If you pre-order right now at nataliecrawfordmd.com/book, you'll get access to the pre-order bonuses, including the IVF guide, which is an online course if you need IVF. And number 2, the hormone lifestyle reset. So especially for those of you asking what may be going wrong or what you can do wanting to take control, this book is for you. So without further ado, let's dive in. So if you're trying to conceive and it's taking longer than you expected, you are not alone. This is actually a very common experience. And I know when it happened to me, led to so much doubt and just confusion on something that I thought would be easy. I mean, I prevented pregnancy for so long, I was surprised when we started having struggle. So we're going to go into the 5 most common things I think about when somebody's having difficulty to get pregnant. Number 1 is going to be ovulation issues. So you've got to ovulate, which is releasing the egg. But what you may not understand is that simply ovulating is the bare minimum, but there's a lot of ovulatory dysfunction that I like to think about spans between perfectly normal regular cycles to I am not ovulating at all. And this can include subtle changes like a luteal phase defect, a shortened luteal phase where you're not making enough progesterone to support an implantation. That's the first stage of ovulatory dysfunction. Second is going to be that delayed ovulation, that long follicular phase, so longer cycles. Then you're going to start to have irregular ovulation where it's totally unpredictable, and then amenorrhea or absent ovulation altogether. Many women will say, I have regular cycles, no big deal. But then if I ask them, how are you tracking? I go into, when are you ovulating? How long is your cycle? Tell me about your luteal phase. Or if they upload their natural cycles data and I can go look at their temp shift and when their period started, I will actually see subtle changes that make me more concerned. So tracking your cycle, that's what you can do about this, because you do not need to try to get pregnant for any length of time. If you're having ovulatory dysfunction, you should go get an evaluation right away. We need to check hormones, ovarian reserve, thyroid, prolactin, try to see if we can get to what may be going on, because you might need medical treatment or you might need hormonal support. So this is not something where you need to try for the classic amount of time. Y'all know I'm not a huge fan of that anyway. I think fertility should be more proactive. We should be diagnosing you and trying to prevent problems earlier in the stage before you start trying, versus the current reactivity that's in the field, meaning you don't even go see a fertility doctor until you've failed to conceive for 12 months if you're under age 35 or 6 months if you're over age 35. But that's the current recommendation. You can come see a fertility doctor anytime, and you absolutely should if you are not having regular, predictable cycles. What does that mean? You should look at a calendar within 1 to 2 days. You should be able to tell me when your period's coming, and it should come then. Your luteal phase should be at least 12 days in length, and your cycle should be around the same length every time. So we usually say that whole span can be anywhere from 24 days to 35 days, but it should always be within a few days for you. 27 to 29 days, 32, 34 days. It shouldn't be 26 days 1 month, 32 the next. That's a little too irregular for me. Number 2, anatomical issues. I'm grouping this all together. So this can mean problems within the uterus or the fallopian tube. These are often silent, meaning you have no idea what is going on here. Things inside the uterus that can make it harder for you to get pregnant can include polyps inside the uterus, uterine fibroids that are inside, can include having uterine birth defects like a uterine septum, or having structural things like adenomyosis in the uterus. And then outside the uterus, we have the fallopian tubes, so they can be blocked, or you could have endometriosis. So, all of this can impact you anatomically and your ability to get pregnant. Unfortunately, diagnosis is not always easy. Certainly, if you're having very painful, very heavy periods, spotting between your cycles, those are signs that you might have an anatomical disruption and should go get seen earlier. But otherwise, if you come in and you either have infertility or you ask for fertility testing, then we will go and look anatomically. Big important thing, a transvaginal ultrasound alone cannot diagnose all of these. So, to see the inside of the uterine cavity, we have to do a more specific evaluation where we put liquid into the cavity to see what's inside. And that can be a saline sonogram, that can be with an HSG, a hystosalpingogram, that can be hysteroscopy where we put a camera inside. But it has to be more than just the vaginal ultrasound because the uterus is a potential space. And if we have something inside your uterus, you may miss it on ultrasound, but when I go and I put water inside, then you'll see that polyp. So, certainly, these are things that sometimes can be fixed, sometimes cannot, but almost always impact your fertility. Number three is going to be male factor. And I would be a bajillionaire if I could get money every time somebody told me it's not him, it's me, or he's fine. And you don't know that. Remember that 50% of the time there's a male contributing factor to infertility. And in fact, sperm factors can change so immensely. So, just because if you have a partner, they had a child in the past or they had a semen analysis years ago, every 3 months, totally new sperm parameters. So, if life has changed, if we've gotten older, if we've gained weight, if we're not sleeping, if we're stressed, those things can all impact the sperm count. So, we always want to get a new semen analysis. And remember, because the sperm is so sensitive, that controlling the sperm with lifestyle is one of the hugest things you can do and something I don't see done enough. So, what does this mean? Smoking, marijuana, alcohol, decrease the alcohol and stop smoking and marijuana. Marijuana is probably one of the top things I am seeing contributing to poor outcomes, even on IVF cycles. We also want to stop any medications that can impact testosterone, like do not take testosterone itself. That can absolutely be problematic. Number three, we want to avoid external heat, so saunas or hot tubs. And number four, we want to drop inflammation. So, really thinking about the diet, the added sugars, ultra processed foods, we want to decrease those as much as possible. Number four, egg quality. I know egg quality gets a bad rap and it really feels like a personal attack. Let's remember that your eggs and the egg quality of the egg, I like to think about it in two different components. So, we have the genetic normalcy of the egg. We know that this decreases with age. Your chromosomes are all lined up in your eggs. The longer they're in your body, the more wear and tear they're going to absorb. And some of this chromosomal damage, you cannot help, you cannot change your age. But the other part of egg quality is the metabolic competency. And this comes down to things like the mitochondrial function and how the egg has the ability to divide, to allow a sperm in, to grow cells. The first 3 days of embryo life are all dependent on the mitochondria and on the egg. So, bringing good egg quality to the table is huge, especially if you're older, because you can't control your egg genetics. How do we improve that egg quality? A lot of this is going to be decreasing inflammation. Inflammation is very toxic to the egg quality. This is going to be your insulin resistance. This is going to be having abnormal gut health. Really thinking about how do we drop inflammation in our bodies. Lifestyle changes that can help these with an anti-inflammatory diet, getting more sleep, movement that's good for your body, but also working to heal your gut, thinking about increasing foods that have lots of good fiber in them, and decreasing toxins, whether that's environmental toxins, endocrine disruptors, those social toxins that we are exposed to that we know raise inflammatory levels. Important note, there are diseases that contribute to having high inflammatory levels that also can cause infertility, and some of these you cannot eat your way out of. So, endometriosis is a good example. If you have endo, you're going to have baseline higher inflammation. But because you can't control it all, and because you might need IVF anyway, you should absolutely control what you can. So, by focusing on those lifestyle factors to decrease inflammation to the point you can, some people will get pregnant that way, but others will say, hey, at least I'm going into my fertility treatments with the best egg quality that I can bring to the table based on the cards that I have been dealt. And that is really, really important. So, remember, don't delay an evaluation. You want to make sure that you're controlling those lifestyle factors. So, nutrition, sleep, movement, toxins, and think about antioxidants to really have that lowering of inflammation. Into this egg quality also kind of goes egg quantity, which is your ovarian reserve. Remember that a low ovarian reserve alone means you have fewer eggs than you should for your age, and you might go into perimenopause and menopause early. This alone does not cause infertility, but is a big red flag to me, making me wonder what could be underlying, and is there something inflammatory that could be contributing to this? So getting an AMH test for your ovarian reserve, although it doesn't tell you about quality, is still a very important variable when you're trying to grow your family. And then number five, classically, they would have me tell you that this should be unexplained infertility. And we're going to call it undiagnosed inflammatory factors because I truly believe a lot of the things that are this unexplained infertility category are all tied together with chronic inflammation and really having a lot of those inflammation symptoms. This can be very frustrating because sometimes you're told your labs are all normal, your hormones are normal, you don't get a diagnosis. But we know you don't feel normal, you're not getting pregnant. And this is where infertility is your body's red flag that something is going on. When I diagnose somebody with this right now, to me, you want to be going into fertility treatments, doing everything you can. So anti-inflammatory lifestyle becomes of utmost importance. I like to make sure we're doing a full thyroid panel, looking for thyroid antibodies. I want to make sure we're looking for early stages of insulin resistance and optimizing that. I want to think about even those subtle ovulatory changes. So you might get undiagnosed or unexplained, but then we go in, we look in, and so often I'll see a short luteal phase. We really look at your tracking data. And what we see is that chronic inflammation is making it harder for the hypothalamus to interpret what's going on and for the brain to send out signals to make enough progesterone. First stage of ovulatory dysfunction associated with higher inflammation. And so that's a case where even though you have unexplained infertility, sometimes we see ovulation induction can be really advantageous. Because this is a frustrating diagnosis, we typically recommend that you do either ovulation induction with an IUI. This is really an odds game. So putting more eggs and more sperm closer together, or IVF. But no matter which one you're choosing, which your doctor should talk to you about based on your age and your goals and how long you've been trying and all your data, really focusing on that anti-inflammatory lifestyle is going to be key for success. And if you have a known diagnosis of something that's an autoimmune disease or endometriosis, that is hugely important to tell your doctor or your fertility doctor because that alone should fast track your evaluation because we know you're going to have a higher chance of having difficulty and struggling to conceive, and we want to treat that earlier on. So you can take proactive steps. Your fertility is not just about luck, and we want to make sure that getting an earlier evaluation, looking out for some of these warning signs and symptoms, that can be really helpful as you're trying to conceive. So let me know in the comments if you want a deeper dive on any of these 5 things that are causing fertility struggles. And please don't forget, all of this is covered in depth in the fertility formula, which you can pre-order now at nataliecrawfordmd.com/book. And you can get more information on the As a Woman podcast. So thank you, friends.